feel connected right now, or you can remain private, whatever you prefer. So how we're going to do this is we're going to go through some slides that are all about getting ready for a fertility cycle. We encourage you to ask us questions throughout the event. So myself and Erica Keller, who will be introduced in a minute, will be the question takers. So send myself and Erica questions, and then we will ask them throughout the talk to make sure that everything gets answered. So the two wonderful speakers that we have leading the event tonight, we have Hina Ahmed. She's a physician assistant at Kindbody, New York. And we have Dr. Amy Sundamarang, who is a reproductive endocrinologist or a fertility specialist, also in Kindbody, New York. We also have Tracy Reynolds. You can give a wave. She works out in Los Angeles, and Erica's in San Francisco, and I'm in New York, so we're representing coast to coast, and we have people here from all over the country and all over the world, which is really cool. Great, so with that, I'm going to hand it over to Hina, and she'll tell you a bit more about Kindbody and then how we prepare to cycle.
Great, thanks so much, Rebecca. Thanks for that introduction. So want to tell everyone a little bit about Kindbody. We are a full service fertility practice. We provide everything as far as fertility is concerned and treatments are concerned, including egg freezing and donor services. And I'll get into a little bit into that on another slide. But we also, along with fertility care, provide GYN care and wellness. So it's everything you need under one roof, from getting pregnant and then carrying you through your care. We believe in a whole person approach to care, which is really important, and not just treating your fertility, but also women's health and of course, mental health and nutrition. We're all about being modern and accessible for anyone at any part of their reproductive journey. We currently have 3 clinics, one in New York City, San Francisco, and in Los Angeles, and we have more clinics to come. And this cute picture over here is a picture of our clinical team. You can see myself, Dr. Amy Sundamarang, she's the second person there from the left, and then Erica's all the way there on the right side, and part of our New York and clinical teams are, New York and San Francisco teams are joining us in that picture. I do want to take a minute and allow Dr. Sundamarang and Erica to introduce themselves, and I'll give you a little bit of introduction about myself before I move on. So Dr. Sundamarang, please go ahead and introduce yourself.
Hi, everybody. I'm Dr. Sundamarang, and as Rebecca and Hina said, I'm one of the reproductive endocrinologists at Kindbody in New York City. I'm so excited to be here with all of you to discuss preparing for a cycle tonight. And a little bit about me, I am in New Jersey, so I'm based in New Jersey. And I have been in practice for almost 15 years. I'm originally from Texas, and we're so excited to present with you guys.
And hi, everybody. My name is Erica Keller. I'm the physician assistant in San Francisco. I work with both the REIs, the fertility specialists, and I also do some general gynecology care. So you can stop by anytime. Originally from the Bay Area, had a little stint at Duke for a couple of years and then joined Kindbody. Love it, and I'm so happy to have you here.
Great, thank you so much. And I'm Hina, like Erica, Rebecca introduced, and I'm a physician assistant out of the New York City office. I've been working in the fertility space for about 13 plus years. And I also live in New Jersey and commute into the New York City office, but sometimes I'll pop up in the other offices as well. Sometimes I'll go visit Erica or I'll pop into the LA office. So really excited to talk to all of you tonight. So I do want to give everyone a little bit of an update on our clinics. Some of you may be aware that fertility practices did put their care on pause for a little bit, but I want to give you this exciting announcement that we are open. We've started seeing patients in New York City this week. Next week, we'll be seeing patients in San Francisco and LA. We are taking the utmost precaution in taking care of our patients, making sure that it is safe and absolutely everything is sterile, and we have these special masks we're wearing, and so we are taking the utmost precaution in seeing our patients, but we are back to seeing them. We realize that fertility care is one of those things that is time sensitive, and some women don't have months and months to wait, and we want to be there for you. We want to be accessible because fertility care is essential, and it needs to be that that way across the board. I want to talk a little bit about our services. So another way that we're providing services, which is kind of new to us, but is very well received by everyone, is our virtual consultations. And so that allows you to have a consultation with the physician without physically having to come in. And with the times that we're in right now, it's a perfect way, a perfect stepping stone to launch your fertility journey. I think it's a wonderful way to meet the team, connect with your physician, and then set up a plan of what the next steps are. And these are some other services that we provide. Like I said, everything under one roof. So you want to start a cycle. What now? There are some things that we have to do to kind of get you ready for the process of planning your journey. Some assessments and evaluations that have to be done beforehand. So let's talk about getting ready. The first step in your evaluation, like I mentioned before, is a virtual consultation. This is the first step for everyone because we need to, one, establish our relationship with you. We want to get to know you. We want to know who you are, talk to you about your fertility goals, and really be able to set up a plan for you to reach those goals. And those goals, obviously are different for everyone. And so not everything listed on this list here is necessary for everyone. But most people will need some type of ovarian reserve testing that's done in the clinic. That would include an ultrasound and some blood work. You may or may not need genetic testing. We're going to talk to you about that on a one-on-one basis. Some people may need to have their uterus and fallopian tubes checked to make sure that they're healthy. If you have a male partner, they may need to have testing on their sperm. And some people may be interested in using an egg donor or a sperm donor, depending on the circumstances. So that too, we could discuss with you as a next step. At the virtual consultation, we go through a health history, we talk to you about all of these details, and then lay out the next steps for you.
Great, so I'm just going to start asking some questions as they come in. So one question is, if you are in your 30s, mid-30s, and you have a partner and you know you want to do fertility preservation, you don't know if you want to do egg or embryo freezing, what kinds of things would you talk about in the consultation?
Absolutely, that's such a good question, actually. So each person is different, and that's, I think, the main thing that we have to understand is that nothing is cookie cutter. And so when you come in for your virtual consultation, there will be a lengthy discussion about what is your exact fertility plan and the timeline of your care. You may say that I'm want to delay pregnancy, but maybe a couple of years, maybe it's 10 years. So depending on all of that information, we will discuss with you what's the best option. So if it is fertility preservation, what in certain circumstances, egg freezing would be a good idea. In other circumstances, embryo freezing is a good idea. It's case to case. And if you are in the same scenario where you're mid-30s, you've been trying to get pregnant for a little while, and that may mean that we need to talk to you a little bit about trying for conception through IUI or IVF. Everything is going to be tailored to you based upon what your body and your conception needs are. So moving on to kind of the treatment plans that we have available at Kindbody, I want to turn the virtual mic over to Dr. Sundaram so she can get into that a little bit and talk about the different treatments that we offer.
Thank you, Hina. I'll take the virtual mic. And absolutely, there are many options. And just as Hina said so well with the last slide, there are many options that are all really tailored to your goals. Some of our patients come to visit to talk about the future. Some really are focused on right now in terms of conception. And sometimes we actually talk about both, how to get pregnant now, how to plan for the future. And we really go through the journey with you and help you walk down that road. In terms of fertility preservation, a little bit more about those options. there are two that we really focus on. One is really egg freezing. That is taking eggs, growing them in the body naturally. They grow in the ovaries, so we help the ovaries grow as many eggs as possible, and then we take them out of the body to save them to use later. With egg freezing, we are really fertilizing the eggs in the future with sperm that you choose at that time. Embryo freezing really focuses on creating embryos at this time, and embryos can be created. We can grow them in the laboratory. We can check them to see if they're healthy. For example, we can check to see if any of them have Down syndrome or an extra missing chromosome that might lead to a miscarriage. It's really great information to have right now before we close that chapter of thinking about later. However, it does commit you to choosing a sperm source, so your partner, a sperm donor, and that's kind of a big choice. So the thing to know, though, is that the odds of success are essentially the same. Egg freezing or embryo freezing really is taking eggs now when they're as good as they ever will be, and then saving them for later. When you do the fertilization now or later is really your choice, and that's something that will help you figure out.
Thanks. And I just got a question about the consultation, the virtual consultation. How long is it? And if you have already done blood and sperm testing or AMH testing, can you send those ahead of the consultation to talk about it during the consultation?
That is actually absolutely possible. So one of the great things about our Kindbody portal is that you can upload all of your records that you have electronically. Send us a PDF, a screenshot, whatever you have, and we can actually review them together at your virtual consultation and give you a sense of how all of that fits together in your plan. Oh, the question about time. So the consultations take anywhere from half an hour to 45 minutes. There's a lot to talk about, sometimes longer. Really, it just depends on what we decide to speak about, what questions you have. But we do reserve a fair amount of time to go over what your goals are, to learn about you and meet you, and then also to answer all of your questions. Any other questions, Rebecca?
Yes, we also have one about if you're using a sperm donor, what's the process for working with a sperm bank? Are there specific sperm banks you recommend? And can you speak a bit more to that?
Yeah, so in a nutshell, sperm donation through a sperm bank is something that is regulated by the FDA, so the Food and Drug Administration. So we work with banks that do exactly the testing that is required, and they do it well. Aside from that, you're allowed to choose any sperm donor you wish. We get you ready for that by checking genetic testing to match up with the donor, checking your health also to match up with the donor, and then helping you go through what the best requirements of a donor are, other than, of course, one's list of desired characteristics.
Thanks. We have another question about the difference between when you'd recommend IUI or IVF. The question is, IUI is obviously a lot cheaper. So what are the scenarios where you'd recommend just skipping IUI and going straight to IVF?
Right, so actually that is on this slide right here in front of us. And those two options really are meant to think about conception or help to achieve a conception in this moment. And IUI is often recommended if natural conception is possible. So natural conception, and Hina will speak to more about this later, but natural conception usually happens in the fallopian tube. After an egg ovulates, the tube picks up the egg and the sperm swim all the way to the tube to fertilize the egg on its own. So if that might be a possibility and we can help that along, then we will often try out an insemination. Obviously, inseminations can be a little less expensive. They are less to do. And if we get pregnant, then it's a great way to go with a little extra help on the side. In vitro fertilization really is super helpful when either IUI hasn't worked, if we're worried about tube sperm or egg quality. And with in vitro fertilization, there is a little bit more to do, but it is so helpful in getting through most of the steps of getting to conception. The sperm are fertilized directly with the egg. It is outside the body, and then we put embryos directly into the uterine cavity, so we're sure that they get to the right place at the right time. Other questions? All right, very good. So a question now, which is super relevant, is whether or not it's a good time to proceed. And we've all been super worried about the COVID-19 outbreak. We're so grateful to be coming to the other side of it. And we learned a lot about COVID-19, about the virus. And certainly one of the big questions is, say I do go forward and I'm pregnant, is that something that we worry about for my baby? And at this point, we really have not found that it has a very big chance of being passed on to the baby. Also, there's very little evidence that COVID-19 affects your fertility or your eggs, were you to freeze eggs now or later. One thing that we have really learned is because of the lack of risk to the baby, or at least as far as we know right now, fertile patients have not been told not to get pregnant. So lots of our patients are trying at home. Lots of people in the world are trying at home, and therefore we're really moving forward with returning to offering fertility treatment, but with enhanced safety protocols, which we've learned about through these last couple of weeks. As Hina spoke about earlier, we've transferred many of our services that can be done virtually to the virtual arena, consults, discussions, talking about results. We've also reduced the time needed in clinic. We'll do ultrasounds and procedures in the clinic, of course, but we've also implemented extensive precautions to ensure your safety, timing visits, disinfection procedures. The flow through our clinic has really been altered, all for prevention of transmission. All right, so medications. So this is one of the big questions that we discuss a lot. And during the fertility treatment, we will give you hormone medications that help your ovaries mature more eggs than they normally would in a natural cycle. It is a big part of the process. And so Hina is going to talk to us more about that.
Great. So in order to understand why you take these medications and what they do, it's really important to understand kind of what happens naturally in the body so that it makes more sense when we go to explain to you what these medications are meant for. In natural ovulation, what happens is, well, let's go even further back than that. Let's actually talk about when someone is born, right? So when a female is born, she's born with the total number of eggs she's going to have for her whole lifetime. And that number is about 2 million eggs. And from the moment that she's born, there's a set number of eggs that come out of storage every month or so, and they're coming out of storage. And obviously when we're infants, those eggs don't do anything. They don't get ovulated, nothing happens, but they still are coming out of storage and we don't use them and they end up going to waste. They just dissolve within the ovary. And this process continues to happen until our brain develops enough that it can actually talk to the ovaries and say, hey, those eggs you've been taking out of storage, let's make one of those eggs ovulate now because this body is ready for pregnancy. It's old enough for pregnancy. And that's when puberty happens, right? So one of those eggs now out of that batch will start to mature and make its way well, ovulation happens and then the egg makes its way into the fallopian tubes. And if there is sperm there, then that egg has the potential to fertilize, and that's the beginning of conception. And so then that fertilized egg becomes an embryo, makes its way into the uterus, and then attaches to the uterus, and that causes a pregnancy. Usually what happens, though, is that that egg doesn't meet sperm. There's a lot of times, right, in our lives that doesn't happen. So it doesn't meet sperm, but then it makes its way, it continues on its journey, in fact, through the tube into the uterus. And since it hasn't been fertilized, it just disintegrates. And this process continues to happen every single month, where a new batch of eggs comes out of storage and one egg matures, and the whole process occurs once again. What's really important to understand is that when we are giving you medications, that the medications that we're giving you are hormones that your body makes naturally itself. There's a hormone called FSH hormone, which is released by the brain, and that's that hormone that is the communication factor to the ovary to make that one egg grow. And we only make a certain amount of FSH hormone, so only one of those eggs will grow. When we give you FSH hormone in an injection form, and this is what these hormones are, it's FSH hormone, that will cause more than one egg to grow. And more than one egg will start to mature and prepare itself for ovulation. That process takes about 10 to 14 days. So you're taking these medications for about 10 to 14 days until you reach a point where your eggs are mature, and then you take something called a trigger injection, which triggers your ovulation. That helps us to time when you're going to be ovulating so that we can go in and retrieve those eggs. You can imagine if you're taking these injections, the injectable fertility medications, that will create more than one egg and can create multiple eggs. And we don't always want that to be the situation, especially if you're having intercourse at home or you're doing an IUI. So other medications are reserved for those kind of treatments. Usually those are oral medications that will help basically optimize your ovulation, but not necessarily create all the eggs, or I should say mature all the eggs that are in the ovary for that month. Maybe one, maybe two, sometimes 3 eggs will mature from those medications, but it's not typical for more than that to start to mature. Where do you get these medications? So they're not readily available at any regular pharmacy. They have to come through a specialty pharmacy, and those pharmacies are usually mail order pharmacies. And we place the order for the medications for you. It has to go directly from us, like a prescription that gets sent to the pharmacy. And then the pharmacy will get in touch with you about cost and shipment and all of that information that you'll need in order to actually get the medications. What's important to understand about the medications is that sometimes in fertility preservation, the medications are not covered by insurance. And unless your employer has opted to include that benefit in your insurance plan, it might not be covered. We will help you navigate this. We have a whole billing team that will help to navigate what medications are covered, whether they're in your plan, whether they're not, if it needs to be self-pay, where's the best prices to get these medications. We're going to work with you. Okay? More often than not, if you have fertility treatment coverage, your medications will be covered under the treatment coverage. That does happen if you have fertility coverage for actual treatment to get pregnant, okay? The price for the injectable medications ranges from $3,000 to $7,000. And the reason that there's such a big disparity amongst this cost, like $3,000, $7,000, that's huge, right? $4,000 is a big amount. But the reason for that is because sometimes, it depends on the person. It depends on how much medication they're going to need. So some women will need less medications. Women who are younger, who have plentiful, what we call antrofollicles, those eggs, that I was talking about that come out of storage, those are called antrofollicles. So you may have a lot of those, and so you won't need a lot of medication because your body will create eggs with lesser medications. And then women who are older, who have a lesser number of antrofollicles, may need more medications to get their ovaries going. And so that's why the cost would be a little bit more extensive on that. And we'll help to navigate all of that. So you don't have to sit here and figure that all out tonight. We're going to help you navigate all of those things for sure. Like I mentioned before, not every treatment plan needs injectable medications. And so if it is oral medications, those are usually significantly less cost-wise if you have to pay out of pocket for them. And sometimes those medications are covered under your insurance plan, even if other things are not. So again, we'll help with navigating all of that for you. When you're ready to cycle, you are going to be taught how to take the medications and how to take the injections. We have these wonderful videos starring me. Just kidding. But these videos starring me that basically will go through all of the medication instructions with you one by one. And the great thing about this is that a video is one of those things, as I'm sure we all know now in this post-COVID world, is that when you're doing a how-to video, because I'm sure a lot of people are doing all these recipes and things at home, you want to be able to rewind it. You want to be able to watch it over and over, put it on a loop. Maybe you didn't understand this part and then go back, watch it every single night. I have patients that tell me, oh, I did my shots with you every single night during my cycle, which makes me feel so great. But those videos are there for you to use and abuse as much as you want, as far as you need it. Okay. I think we have a question.
Yeah, Hina, this is a really good question that I certainly get a lot in San Francisco. What if I have really, really, really bad needle phobia? What do you recommend for patients?
Great question. So if you do have needle phobia, one, I want to let you know that these needles are very tiny. They're not very large. They go in your belly, and they are meant to be self-administered. So they can be done that way. And if you are having trouble, there's some hints and tricks that you can do. We can give you a lidocaine gel to put on top of your skin to numb the skin. We can give you, there's patches that are available that will also numb your skin. We can do that. You can use ice sometimes, that will help to numb the skin as well. So those are some tricks. If you're really afraid, you can enlist a friend, or you can enlist your partner as your, person, your injector. They'll inject your medications for you. But they're really not that hard to do. And really getting over that first injection is the hardest part. And once you give that first injection, you realize it's not bad at all. And I can tell you that in all honesty, I've been doing this a very long time. I've never had a patient tell me I absolutely cannot do this and cannot proceed. And if you really are having trouble and you want us to do a one-on-one in person in the office, we can definitely do that as well. If you want us to FaceTime with you while you're taking your injections the first night that you take them, make sure you do it right. We can do that too. We are 110% accessible to our patients all the time. Okay?
Thanks, Hina.
All right. And then some side effects. So side effects is a big question that we get, because you hear all these things, especially on social media or like on TV shows, and they talk about, well, I feel horrible on these medications. Well, you have to know that really the most common side effects from the medications that people feel are cramping and bloating. And really, it's very limited. And it's because your ovaries are getting larger. We are growing multiple eggs. And so that's why we have to, create basically it creates an environment that's a little cramped in there. And that's when you start feeling a little bit bloated. Having heightened emotions or fatigue, those are less common. And even when you do feel like you're having heightened emotion, it might just be that certain things, you're just a little bit more sensitive. Like when you're watching a commercial or you're watching a TV show, you start to cry and you're like, why am I crying about that? Oh my God. So you may notice that a little bit more, but it's not anything more than that. And most people generally tolerate these medications very, very well. And other things that can occur to a lesser degree is some reaction to the site of where you take the injection. And that usually is self-limited. So it will be there for a little bit and it'll go away. Now, if it continues, that's something to worry about. So we would definitely ask you to let us know about that. And there's a small risk of something called ovarian hyperstimulation syndrome. The important thing that you need to know about ovarian hyperstimulation syndrome is that you just need to know about it. It doesn't generally happen. It's so rare, but you should know what it is. You should know some of the signs, which is you start to feel bloated, you feel a little bit uncomfortable, you become very dehydrated. So one of the things that we can do to help with ovarian hyperstimulation is to stay very well hydrated, drink a lot of electrolytes. We will know that you're starting to become hyperstimulated. And hyperstimulation is basically when your ovaries start to stretch and there's some fluid there, and that fluid sometimes spills into the pelvis. But we know that's happening before you do. And what we do is when we're monitoring you through the ultrasounds, we'll be giving you tips and tricks and things to do to prevent you from becoming overly stimulated and getting to a point where you're very uncomfortable. Okay? All right. Now we want to talk a little bit about the process and what are the things that we need to do to get us to the point of egg retrieval. So
a couple of questions actually, Hina.
Oh, okay, great. Yeah.
We had a few questions about the side effects of the hormones. One question is, can they compromise the immune system? Another question is whether they can cause cysts or why they might cause cysts.
Yeah, that's a good question, actually. And a lot of people do ask that. And so you have to understand that when your eggs are growing, they're basically growing inside of a cyst. And those cysts become very large because the egg inside is what's creating the fluid that stretches the cyst. And when ovulation happens, that egg leaves the cyst and the shell of the cyst is left over, and that's called a corpus luteum cyst. And so when people say, I got cyst after my egg retrieval, or I came in and it caused me to have multiple cysts, it's because all of these eggs have left, we've ovulated them, and what's left over are these corpus luteum cysts, these shells. And those cysts in a normal cycle, they produce progesterone and they help sustain pregnancy, but it is part of the process. What is important to know that these cysts will go away. They're not permanent. They do go away. The fluid eventually reabsorbs into your body. Your ovaries will shrink down. The cyst will dissolve, and a new set of eggs will come out the next month. The sun will come up, I promise. So I want to hand over the mic again to Dr. Sundermrong so she can start going over kind of like what the process is during the cycle.
Thank you, Hina. Right, so monitoring. So we do monitor the ovaries and what we call the ovarian response to the medication during the cycle. One, to make sure that the ovaries are growing eggs as we hope they are, and also to monitor for all of those side effects that Hina just talked about. One thing to know about ovaries is that they are very different for everybody. Ovaries are just like us, we're all different, and they're very individual. And we like to make sure that the medication that you're taking is actually helping your ovaries to grow to their best ability. So we will tailor the protocol of medication that you're taking to your ovaries directly. In order to do that, we have you come into the office for an ultrasound and a blood test every few days to check the follicles, those cysts that Hina just talked about where the eggs are growing on the inside. As they get bigger and bigger, we know that the ovaries are working on the eggs on the inside to mature them. The blood work is really to check for the hormones that each of those follicles is developing. Hormones both feed the egg, and they also let us know how close the eggs are to maturity. And every time you come in, we like to check on the dosage of medication, basically, again, the food for the eggs, and then we sometimes adjust the doses to give them exactly the right amount of food for them to grow.
I have a quick question, Amy, before you move
Yeah,
forward.
sure.
We know that we have to see patients every 2 or 3 days while they're cycling. Are there any other time restrictions around that?
Right, so the visits are scheduled so that we can get the results of the evaluation, both the ultrasound and the blood work, back the same day. So we often do have visits for monitoring in the morning. Sometimes it's called morning monitoring. One, allows us to get results back the same day. Two, it does allow most women to attend their visits and then go to work later so that it really is a minimal disruption to your schedule. And right now we are spacing visits out a bit to allow for flow through the clinic in an individual manner due to the COVID-19 outbreak. So there are a few considerations, but we always work with your schedule to make it flexible enough to continue with regular everyday life.
Thank you.
We also have a question about the total number of visits. So what is like the minimum number of visits you'd have to do? What's the maximum number for one cycle?
Yeah, so the beginning of the cycle is a little bit spaced out. So when we say 2 to 3, the first couple of visits after you start your cycle are every 2, really every 3 days. As we talked about, the stimulation protocol is about 10 to 14 days. So the first week, maybe we'll have 2 visits in that time frame. Now the second week is a little bit more frequent. We do monitor a little bit more frequently, mostly because we're trying to precisely time when to do the retrieval. And so there are usually visits every other day the second week, and it ends up being about 5 or 6 visits within that 2-week period of time, outside, of course, the egg retrieval. So it is, a lot to do. We get to be really good friends over that 2-week period. Again, the first week is less intense, the second week a little bit more frequent.
Thanks. And then one other question about the time. So what's the amount of time if you have a virtual consultation and you want to proceed with a cycle? Like what's the shortest amount of time you'd be able to do that in?
Right, so it really depends on if you've had any workup before, and then also what your goals are. So some of the tests for, say, preparing for pregnancy, the hysterosalpingogram, checking your tubes, which we talked about a little earlier, some of those are timed. Also, if we are evaluating a partner's sperm, we have to work with their schedule. If we are thinking about doing a fertility preservation cycle, especially with egg freezing, when we're really working with your schedule alone, we really just need to do the fertility assessment. It can be super quick, and sometimes we have results that we have already had, say, a month or two or even 3 or 4 months before, and we can really just look at your calendar. We will talk about the calendar just a little bit, and then just pick out your best time to go forward, and it can be, visit to starting your cycle in a week or two. So it is pretty straightforward, but always really tailored to your goals. Yeah, very good. So yeah, we'll move on to the egg retrieval. And this is really the main event in an egg freezing, embryo freezing IVF cycle. This is the day that we actually remove the eggs from the ovaries and then either freeze them or fertilize them. So all the work that we just talked about, the ultrasounds, the medications, that all leads up to this moment. Now, with all of that, it is actually just a 10 to 20-minute procedure. It's pretty short. We do place a small needle through the wall of the vagina directly into the ovary, directly into each follicle to gently suction the fluid inside the follicles out with the eggs. It sounds like a lot, and so definitely a light anesthetic is super helpful. It keeps you comfortable, you're asleep, all you know is we're talking to you, take a very nice nap, and then wake up seemingly in an instant. The procedure, though, because it's under anesthesia, you're not meant to drive that day. We do want you to have a friend to come with you and help you get home. And the day of the retrieval, we don't want you to work, take any meetings, make any big decisions. So it's really a day on the couch with lots of soup and lots of things to watch on TV. Now, once we fertilize the eggs, if you are freezing embryos, we get sperm to the egg that day, and we grow the embryos out for the next 5 or 6 days, and then we freeze them at that point. If we're doing in vitro fertilization, based on your plan, we may do a transfer 5 or 6 days later, or we freeze the embryos and then test them and do a transfer in the next month. So while the retrieval is very much the big D and the big main event, what happens afterwards is based on your plan.
Dr. Amy, do you have any tips for someone who is afraid of going under anesthesia for the retrieval?
Absolutely. So one thing to think about, I think the apprehensive are really feeling nervous about it. The anticipation is always worse than the procedure. The breadth and depth of our experience, most women feel very normal after the retrieval. Is super difficult to think about anesthesia, but most women will say that it was a great nap. It happens in an instant and it's super safe. To put it in context, some things to think about are it's the same type of anesthesia if when we're to get a colonoscopy or any type of minor GYN procedure. So it's very, very simple. And we are with you the whole time. Our anesthesiologists are great. And so we make you feel super comfortable and super safe during the procedure. Other questions, if any? All right, so we're going to move on to do's and don'ts. So a lot of thoughts during this cycle are, well, what should I do? Do I have to change things about my life? We'll focus on the do's first. And those really are things that we want you to do to be healthy. So maintain a good diet, get lots of sleep. Hina talked about hydration and electrolytes. Exercise, this is a big question, mostly because we do want you to exercise. Exercise is great. The thing that we don't want is to kind of make the ovaries any more uncomfortable if they are already uncomfortable. So low impact exercise is really what we think about. Walking, stationary bicycles, We do want you to try and relax as much as possible. Meditation, we've done some wonderful things this week that you can try at home, and also to communicate with us. So we are available all the time. We want you to ask all of your questions. We want you to feel completely sure about your instructions. We are available 24/7. I always tell everyone we're not maybe awake at 2 o'clock in the morning, but we are available. And we want you to have the best experience with your cycle. Now, some don'ts: limiting toxins and things, alcohol, caffeine, avoiding intercourse during fertility preservation cycles. You do become super, super fertile. And so what we don't want, or we want to avoid, is any unintended pregnancy, high intensity exercise, and then prolonged travel. As we talked about, we do need to monitor the growth of the eggs inside the ovaries. So we do need to see you back in the office. And without being able to monitor you, it is hard to get a very excellent response from the ovaries. So we do organize your cycle so that you can be at least available for those visits during that 10 to 14 day time period.
I have a quick question, Amy, that I think is great for everyone to hear.
Yeah.
This is a great list of things to do and not do during your cycle, but are there any vitamins or lifestyle changes that patients should make before they do IVF or egg freezing in order to improve their outcomes?
Yeah, so there are lots of things we talk about during the consultation, which may or may not apply. Things that we do think about just in general categories. One is actually modifiable risk factors for poor egg quality. So one thing that we talk about all the time is smoking. If you smoke any type of tobacco or any type of other substance, reducing that as much as possible before your cycle is super helpful. General health is great. So optimizing any type of chronic medical condition, vitamin levels. We check vitamin D, for example. We have you start vitamins if you're trying to get pregnant for iron and folic acid, so prenatal vitamins. And so those things are really great to think about beforehand. And always diet, exercise, and mental health are really, really important. We do want to see that you're in the best place possible before your cycle. And we do have counselors that work with us very closely. You can actually book visits with them before, during, and after your cycle. And they're really in tune to everything that we do in the clinic and outside. And so all of those things are super important to think about in the time that you're preparing.
And if I can just add to what Amy had to say, but if you are trying to get pregnant, just make sure that you're on a prenatal vitamin. It's always good to start them early. We want to start them, at minimum like 3 months before, but don't worry about it. If you're not on them, you're trying to get pregnant, just start them now. It'll be fine. Okay. And then a question I get a lot is there any supplement that'll help with my quality of my eggs or the number of eggs? And unfortunately, there's nothing that's super great at that. But there are some studies on coenzyme Q10 that show there could be some improvement in not necessarily the egg count or the quality, but just in the egg environment. And so people have asked about that, and so I just wanted to add that on there, that is a supplement that you can take. And it is too good. Mm-hmm.
Oh no. Yeah, no, I was just saying we do have a list of supplements that we can certainly go over with you, and it is definitely something that we'd like to start beforehand, especially for conception, but looking at your entire health, endocrine disorders, so any hormone changes, thyroid disease, optimizing all of that beforehand is really helpful.
Right, absolutely. And we also have some supplements and things that we sell in our retail space. And then you can get to that through our website as well.
Absolutely.
We have a few questions about the do's and don'ts. Can you define the fertility preservation period during which you need to avoid intercourse during?
Right. So the growth period of the eggs is that 10 to 14 days that we talked about, and really we we know that sperm cannot live for the entire 14 days, but we do want to prevent any unintended sperm from joining with your eggs and again, going forward with an unintended pregnancy. So usually what we say, just to be super, super safe, is that once you've started your injectable medications, that we don't advise having intercourse during that time frame. And then after the retrieval, we advise not having intercourse until you get your next period.
Thanks. And then we have a question about dieting. Do you have any specific dieting tips, things to avoid eating or to eat during the cycle period?
So we do like to make sure that you have enough electrolytes and enough protein. Those are two things that are really helpful for keeping your health and your hydration in check during the cycle, especially when the follicles are accumulating fluid to grow the eggs. You do need a lot of that. Otherwise, there's no absolute best diet other than a really nice balanced one, lots of vegetables. It doesn't mean you have to eat meat, but we do want you to have protein. So those are things to look at. Again, limiting alcohol and caffeine, which are not necessarily dietary regions or items, we do want to limit that during the cycle as well.
For same-sex couples, is there any reason to avoid sex for them as well?
Generally, so I think the question is if you are going through a fertility preservation cycle and there's no chance at conception, then you do not need to avoid intercourse at that point. We are going to be doing and hosting a LGBTQ event later on this week, so certainly we can go into more detail about different options and how we go forward with that, but certainly the meaning or the reason for avoiding intercourse is really to prevent unintended pregnancy. Now, during other cycles where we are going forward with, say, ovarian stimulation for in vitro fertilization to conceive at that time, then the other thing that we sometimes worry about with the end part of the cycle when the ovaries are very large is just the discomfort of having vaginal intercourse and then also disturbing the ovaries.
And we have a question about marijuana or THC. Is that something that you should also avoid during this time period?
Absolutely, right. So reducing any other types of toxins to the body, we do recommend that. Okay. All right, so the timeline, this is a bit of a sample calendar. Things to know, it is about a 10 to 14 day process to grow eggs. That's just the natural timeline. Even in a natural cycle when we're growing one egg at a time, it takes about that time frame. This sample calendar is something we would work out with you. And we do plan your timeline together. So usually we will start the medications when the eggs are ready to start. So if we are looking at a natural period, usually that's day 2 or 3 of your cycle. We always count cycles from day 1 of the period, so the first day of bleeding. Now, this calendar can be altered in that we can move the time frame backwards or forwards depending on travel schedules, work schedules, life schedules, and we can do that based on your periods. We have ways to adjust when we are starting the process. So the bottom line is we do need about 2 weeks of your time, but we can really plan your timeline together to make it work for the rest of life. All right, so Hina is actually going to go through some other information here about costs, next steps, and take it away, Hina.
Great. So about cost and next steps, like I mentioned earlier on, the first step for anyone really is an appointment, and that can be done through the virtual consultation. Something really cool that we're doing today is giving everyone a promo code that they can use to get 50% off of their virtual consultation cost. And the other thing that you should know is if you have insurance, most insurances will actually cover the cost of your virtual consultation in full, except for your copay, of course. You'll just have to pay a copay. With that same promo code, you'll get $1,000 off of an egg freezing cycle or an IVF cycle. you may be wondering, like, with everything going on, is, like we talked about before, is this a good time to cycle? For some people, it might actually be a better time. If generally you're traveling a lot, you have a lot going on with work, things are kind of slow. So this may be an ideal time for you. And for other people, there may be another time that works out. But because of the way that we have alter the way that we're seeing patients, doing a lot more virtual things virtually. Patients don't have to come in as much as previously because now we have this whole virtual platform. And also, whatever time you do spend in the office, we want to minimize that as much as possible and make sure you're getting your questions and everything answered, but you're not having a lot of exposure to multiple people. We're taking, like I said, the utmost precautions, sterilizing, cleaning things down, making sure that everyone gets a temperature check at the door and not allowed to come in if they have anything, even a slight temperature. And we're also, providing masks in the office. If someone shows up without a mask, we have them available. There is hand sanitizer everywhere, I'm sure, as people can imagine, and we are constantly sanitizing things. So all of these things are being done in order to keep everyone in the safest environment, not just patients, also staff, everyone in the safest environment possible. Just to schedule your virtual consultation, there's a link there that you can go to and then schedule right off of the website. If you've already had a consultation, but you're not really sure what you want to do next or next steps, or even if you're a little bit unsure about timeline, whatever the case, just make sure to reach out to us because we do want to talk to you and see what makes you feel most comfortable as far as your next steps and what you'd like to do. But we want to let you know that we're available for you. We're here for you 24/7, whatever you need. Just feel free to reach out and contact us. And anyone, if they have questions, also can email us at navigator@kindbody.com.
I do have a number of questions right now to ask. The first is, how long are the results of an assessment valid for? So if somebody already had a consultation, say last fall, would they need to do it again if they're interested in cycling now?
So a lot of the testing is good for a year. There are a couple of things that we might need to do if it's been more than 6 months. And AMH is an example of that. We do like to check your AMH every 6 months to make sure it hasn't changed too much. And we may also want to, depending on how things look, do another ultrasound as well to take a look at the ovaries and see if anything's changed on your antral follicle count. But things like infectious disease testing, some of the screening tests that we do, that's good for a year. Genetic testing is good forever. Once you have it done, you don't ever have to do it again usually. Yeah.
And I would say also, if anyone's unsure if they had a consultation 8 months ago, exactly a year ago, just email us at navigator@kindbody.com if you have any questions, and we'll let you know you should come in for have another consultation, or you're good to start moving forward.
Yeah, absolutely. And we, trust me, we are very much on board with not overdoing things and not repeating tests if they don't need to be repeated. If you've had things done at another place, you've had let's say you've had a HSG done at another doctor's office, we're not going to make you do it again, just bring us the records. There is a time frame for things and certain things that might mean that we do have to do it medically, repeat a test, but if it's not necessary, we're not going to make you do it, promise.
And then we had some questions about how long the codes are valid for, which I can answer. The codes are valid for the month, but you don't have to actually cycle this month. So you can just schedule something and then we'll figure out a timeline that makes sense together. And then we have some questions about the cost of IUI, IUI cycles, the cost of oral medications for IUI.
Yeah, absolutely. That's a good question. So it does depend on what type of medications you're taking, the cost of the IUI. And so the IUI, if you're taking oral medications, and oral medications would mean you're taking something to induce ovulation, and then you're taking a medication to trigger your ovulation. That would be for IUI. The cost of a cycle is $1,200. And the medications usually run under $500. I mean, I think that a lot of times the tablets are covered, like Clomid or Letrozole may be covered. And then the Avidril injection, which is the trigger injection for that type of cycle, is somewhere around $150 or so. So, and again, we can walk you through that. We can get a quote for you before you start. You don't have to pay anything up front until you know you have 100% transparency about all of the costs. And that's a really big deal for us. We want to make sure that we are 110% transparent with you about all the costs. We don't ever want you to have any surprises about anything. And then I just to touch upon, if for some reason we end up doing like injectable fertility medications and an IUI, which is, it depends, you have to be a candidate for that. But that type of cycle requires more visits, and so that's a little bit more. And I have to actually get the call. I think it's $2,500 for the cost of that.
Yeah.
And what exactly is included in the IVF cycle cost?
Yeah, great question. So the IVF cycle cost will include your visits to the office. It'll include the venipuncture, which is drawing your blood. Every time that you come in. It will include the egg retrieval itself, the anesthesia, and freezing of your eggs or your embryos. A lot of places do not include the freezing cost of embryos in their cycles. We do, and that's in every type of cycle that we do where we have to freeze embryos. It's an included cost. In IVF, it would also include if you needed ICSI or not, it's already included. If you needed assisted hatching or not, it's already included. I think I said anesthesia cost, but that is included in the cycle as well. What's not included is the cost of the medications, because that is billed to you by the pharmacy. We don't really get involved in the cost of the medications, but we will help you get that price quote. We will help you find, if it's not covered by your insurance, find a pharmacy that has the cheapest cost. We do have relationships with certain pharmacies that give us really good pricing. So we will, extend that obviously to you, and we try to help wherever we can. And the other thing that's not included sometimes is in some cases, in some circumstances, the blood work that's done during the cycle, it does go through your insurance, and some insurances will not pick that up and cover that. And if that's the case, that usually runs about $800 or so. Any other questions or anything?
We have a question about the timeline process for IUI.
So timeline process is pretty similar. Dr. Amy, do you want to take this question?
Yeah, absolutely. And IUIs are also based on the timeline that eggs grow. So again, it takes about 10 to 14 days for eggs to grow. So we always start at the beginning with everything. And then the IUI itself is, if you think about timeline, it kind of ends up being the same day of the cycle that the retrieval might be on. So we wait till the eggs grow to maturity or to the size that we could hope for maturity. We will do a trigger injection, and then 2 days later, the IUI procedure. Now, as far as the IUI day, the IUI itself is a very short procedure. It is not under anesthesia. It is probably most like a pap smear in experience. It takes about 5 minutes. As far as the sperm go that day, if we're thawing sperm, that is done shortly before your procedure. If we are using partner sperm, then we do have partners produce a fresh sample. We wash the sperm, which takes about an hour or two. No one needs to be in the office as far as you or your partner at that time. It's really just a waiting period, and then we have you come in for the procedure later on, and that takes, again, about 5 minutes to do. So pretty straightforward.
Great.
And I just wanted to touch upon, oh, sorry, did you have another question, Rebecca?
Yeah.
Well, I was just going to say, I think the next part is questions. So you can keep questions coming about any part of the conversation now, and we'll try to get everything answered.
Yeah, absolutely. And I just wanted to talk a little bit about insurance, because a lot of people have questions sometimes about what's covered and what's not covered. And so we do accept all major insurances. Whether or not the fertility treatments are covered under your plan is based upon your individual plan. So if you tell us, I have Aetna, will it be covered? It doesn't necessarily mean that we'll be able to figure that out just by knowing the name of your insurance, but we will help guide you through that whole process. One of the things that you can do now is while you're waiting for your virtual consult or you're waiting to cycle, you can call your insurance and ask them what's under my fertility coverage, and they can give you some details. Before you go through your cycle, before you start anything, we will check your insurance. We will see what is covered. We'll see if you have coverage for IVF, IUI, whatever the situation, and counsel you based upon that. Some insurances require an authorization. We will help you with that. We have a whole billing department that will guide you through all of these things. So you don't feel like you have to figure it all out tonight. You definitely do not. We are here for you. But in case you want to do something proactively, you can give them a call and see if you have any basic fertility coverage, and they'll go over it. Now, if they tell you something on the phone, it doesn't always translate out as you actually have coverage, depending on the situation, especially for there are some nuances. So that's where we come in, and we're going to help you. Okay. Virtual consultations and any virtual follow-ups, the clinic follow-up that you have, those things should be covered by most insurances. And so, that will be submitted, and you would just have to pay a copay for that. Okay. And then, of course, if you are out of pocket for those consultations, we have the promo code here. And yes, the next slide is questions.
Sorry to jump ahead before.
No, okay.
We do have some more great questions. So now's a good time. If there's anything that you're still wondering, any burning questions, please ask them now, and we'll try to get everything answered. So one we just got is, what is the maximum number of fertilized eggs that we would implant at one time?
So embryo transfer, meaning how many embryos we would put into the uterus, really for the most part is 1. So for most couples who are starting out on their journey, with women who have a normal embryo genetically, we put 1 embryo back. Certainly, if you look at the history of in vitro fertilization, 2 embryos, a double embryo transfer was certainly the standard of care a while ago. 3, 4, 5 embryos have certainly been transferred in general in the history of IVF. But there are 2 things that really help us to get to a single embryo transfer, which is the standard of care now. One is that we can reliably freeze and thaw embryos. So there's really no benefit to putting in a second embryo. And the risk of putting in a second embryo is the risk of multiple pregnancies. So putting in 2 or 3 or more embryos only increases the risk of a multiple pregnancy, which if you have more than 1 baby at a time, twins or triplets or more, there's a very high chance and an increasingly higher chance of having what we worry about most, which is a preterm or premature delivery or a premature baby. And you can have a perfectly healthy embryo and a perfectly healthy baby, but just the fact of being born too early can put them at risk for structural problems, physical delays, cognitive delays, things that we would never wish for our children. And so it is always best to put in 1 single embryo at a time if it is a healthy embryo.
So what are the best options when you are wanting to have twins?
So we don't really do things to increase the risk of twins deliberately. Again, because our goal is that you have a healthy baby, and the best way to have a healthy baby is to really have them 1 at a time. Absolutely, twins are super cute. There are lots of lovely double strollers, things that we all look at. But medically speaking, even a month in the NICU, the neonatal ICU, can really be devastating for babies, for families. So we really do try to promote singleton pregnancies, 1 baby at a time, as much as possible. Sometimes we get twins, and if we are doing ovulation induction for intrauterine insemination, for example, sometimes we will have a second egg that makes its way into the uterus, and absolutely will support and help you along every step of the way. But we really do try for 1 baby at a time.
Thanks for getting a lot of really good questions. Do we provide care through delivery, or where does the care start and stop with
Right.
Kindbody?
At this point, we do take care of the first trimester. So this is checking the pregnancy, making sure it's in the uterus, checking how many embryos there are, making sure that we have what we call an ongoing pregnancy. At this point, we do not do second trimester care, so we can take care of any complications of the beginning part, but once you get to the second and third trimester, we do refer you to trusted providers to help you through that part of pregnancy and then delivery. And then certainly we can see you for postpartum care, postpartum coaching, any of your GYN visits afterwards. And then, of course, if you are thinking about another pregnancy, we'll be here.
And then a very good question about payment plans and if Kindbody offers payment plans.
Yeah.
So I can take that one. So we do offer payment plans, and we can talk to you about that once you come in and depending on what cycle you plan to do. But we work with Future Family, and they are basically a company that will, work with you, and a lot of people have actually been able to get payment plans through them. But we do have options for that, yes.
Thanks. Just a couple more before we wrap up. Do we have any special pricing for reciprocal IVF?
Well, yeah, I mean, that's a good question because a lot of people ask me that. And so what we do a little bit differently at Kindbody is that we treat the cycle like it's one cycle. A lot of practices will treat it like it's two separate cycles because it's two separate patients, but it's treated actually as one cycle, meaning someone's going through egg retrieval and someone that we're just swapping out the person who's having the transfer. And so that's why the cost is a little bit more affordable. And for every reciprocal cycle, it's about $17,000, which would include but that includes the genetic testing. And we can talk to you one-on-one on the cost when you come in, but that'll include genetically testing your embryos, freezing them, and then transferring them into the uterus later.
And is there any discount if you're doing multiple cycles for either egg freezing or IVF?
We do have multiple cycle packages that you could look into. Everything's on the website, in fact, so you can, especially for the multiple cycle plans, the pricing's on the website. And embryo banking.
Great. So I think we're going to wrap up in just a minute or two. If there's any final thoughts that you'd like to share, Hina or Dr. Amy, with everyone right now, I think that'd be great.
This was so great to share all this information with you guys, and we really appreciate you attending and all of your really great questions. Definitely keep in touch with us. If you have any other questions, please feel free to schedule a virtual consult. We'd love to meet you guys one-on-one. And we're so happy to be available on the other side of this COVID-19 outbreak. So stay safe, stay healthy, and we'd love to meet you.
Thanks, and I'm just adding that we will be adding this to YouTube. So go on YouTube and subscribe to Kindbody. This whole chat will be there, and we're going to send out an email with that discount code and all the details, so you have that handy.
Absolutely.
Sorry. One last thing I'm sorry. One last thing I would say is I haven't been able to get back to all of your questions. I'm really sorry. The questions have been wonderful. So if you do have any further questions we didn't get to, feel free to reach out. And I'm so sorry, Hina, to close us out.
No, that's okay. I just wanted to wish everyone happy Fertility Week.
Yeah.
And because I didn't get to say that at the beginning of the talk, I skipped over that, but happy Fertility Week, everyone. And I'm so happy that you're all here empowering yourselves, learning about your fertility, and taking charge.
Thanks. Bye, everyone.
Bye, everyone.